Welcome to the What's Happening Birmingham video podcast.
Hello, everyone. This is Jarvis S. Scott with What's Happening Birmingham. Today, I got the honor and pleasure, got Joshua and Campbell with Cahaba Medical Care. They're here on the podcast today to talk about this new great program. I'm going to make sure I title it Community Health Center Land State Only Accredited Nurse Practitioner Residency Program. So, good afternoon. Thank you all for coming on today.
Thanks, Jarvis.
Great. So, tell me about this. This is a great recognition.
Yeah, the accreditation you're talking about?
Yes. Yeah, tell me more about it.
Well,
yeah.
Go ahead, Josh.
Go ahead, Campbell. Yeah, no, go ahead, Campbell.
Oh, so the accreditation is very exciting. We worked really hard to get here, and it just is a testament to our program, and shows that it helps hold us accountable to continue graduating really reliable and competent and confident nurse practitioners out of our program. And so it makes us the first in the state to receive this status, and one of the first 20 in the nation to receive this status out of about 250 nurse practitioner residency programs.
Oh, wow, that's impressive. So for people who, we're not so used to the titles, what actually does a nurse practitioner do? And that's the difference between just nurse.
Yeah. A nurse practitioner is essentially an RN that decided to go back to school to learn more about medicine. Commonly in the primary care outpatient environment, we are seeing patients. They come in and check in on our schedule. We have a panel of our own patients, and then they leave. And we are the, start and the finish of that visit. In Alabama, there's some restrictions where we have to collaborate with a physician. They have to review 10% of our charts. But essentially, outside of that 10%, we see and treat whatever your specialty is completely by ourselves.
Yeah, because I noticed that a lot. Like, say, for instance, like if I go into the doctor and the doctor's not available, say, well, bring the nurse practitioner in. So it's kind of like, I like that, because I always wonder, like, what's the difference between those two, between nurse and,
Yeah, and we're really blessed. I think it's in many ways a necessity to have the physician that you can call if you do have questions for. We always have that as a backup, but oftentimes, especially as you kind of grow in this field, you end up seeing them and making a lot of the medical decisions on your own.
Okay, and I see, just reading through the press release. So this is actually a 15-month program?
That's right. Yeah, we initially started off doing 12 months, but we extended it to 15 months. In comparison, if you've heard of, doctors when they go through their family medicine or they go through their residency training, many programs set a number of patients that you need to see to kind of say, hey, you've grown this far and you've had this much experience with training. And we in a lot of ways, we end up matching that number that a lot of the doctors do in their 3-year residency. We match it in our 15-month residency because we're strictly outpatient. A lot of doctors in their 3 years of residency, they see a lot more inpatient things, hospital visits. We don't do that. We're focusing primarily on outpatient. We get them a great deal of patient encounters to kind of get their feet wet and learn with.
So have you seen an uptick in people wanting to be nurse practitioners even through COVID? Have you all?
I don't know, Campbell, you may be able to speak to that better than me. I don't know I do think that COVID has impacted the amount of people that want to apply to become residents in general. I think a lot of RNs are really enjoying that travel pay. and they think, I don't need to go back. And, because truthfully, you do get paid more to be a nurse practitioner many times than an RN. So some people see it as just like a career advancement. And maybe, if anything, it might have decreased a little bit through COVID, but I won't pretend to know all about that.
So I guess, Campbell, before I try to answer the next question.
Okay.
what I want to know is, so, I mean, I try to do a quiz. What's usually the starting pay for nurse practitioners? Just starting out, just average.
It really depends on the state and where you're practicing. It's
Okay.
very dependent on if you're in an urban setting or a rural setting, if you're in a hospital, out of a hospital. So it's very dependent on where you're practicing.
Okay. So, easy question for both of you. I love to get your own individual answers. So, why did you all choose a career in the nurse practitioner field?
You go ahead.
I really loved science and math and biology through college. I knew I wanted to do something in healthcare. I was very non-committal, and I didn't want to commit to something when I was 18 years old that I was going to do my entire life. So I had about 5 majors through college. I heard about nursing, and I heard about all of the opportunities and the fact that you can change your career and still be a nurse throughout your whole life. So I didn't really have to commit to one thing right out of school. So that's why I decided on nursing. And then just being at the bedside in the ICU that I worked at, I really wanted to help keep patients out of the ICU. So that's really what led me to primary care and wanting to provide care to patients outside of the hospital setting and trying to keep patients out of the hospital. And I felt like if we have more primary care providers that are able to provide care to patients that don't have access to care, hopefully that will keep a lot of patients out of our sickest hospitals in the state.
Yeah, and I don't know if mine is as well done as Campbell's. I think I really I felt a calling early on in my life just to serve people and love people, and I felt like this is a good. It was in a science class in 10th grade where it was just very clear that I needed to get into healthcare, and then it transpired. I shadowed a nurse practitioner one day and saw the platform that they were able to use to really speak into people's lives and to just help them with whatever they're going through. And of course, I definitely have always loved the sciences. I don't know that I loved it this much as I started to figure out when I got into it, but I just wanted to serve people.
Okay. And then I guess I want to say one of my final questions is, this one's even more easier. What makes Cahaba Medical Care so different than all the other ones?
I think we both might have something to say on that, but I'll start. Cahaba really goes to where, honestly, Jarvis, where no one else is and no one is providing health care. We're a federally qualified health center, a 501c3. We're a teaching health center, but the one of the biggest missions is to go to the underserved. And Cahaba has been extremely blessed over the past, way before I even knew what they were doing great things, going into communities where they just had nothing. They couldn't afford to get adequate health care. And Cahaba's passion is to not just provide some health care to the underserved, but high quality, excellent access to care for anybody, regardless of your ability to pay. So that is one of the things. I think I love the people here, the mission and the vision. Like, they care. There's a calling in everybody's heart, it seems, just to love and to serve. It's a special place. It's a special vision. There's special people here. The residency is just a facet of that, and we're thankful to be able to train people under this umbrella of its main mission.
Okay, Campbell.
I think I just really love that Cahaba facilitates an environment where we're able to do this mission, and we're able to do it so well that we really want to provide care to people that have access to care and people that don't have access to care, and that they're all getting the same care, and we're able to provide the same quality care to patients without insurance that don't typically have access to specialists and things like that. And because of our resources and our connections and things like that, we're able to get them in with specialists if they need it, or we're able to get an x-ray that they couldn't afford if they just went to American Family Care. But then at the same time, a patient that can go to American Family Care can come see us, and by coming to us, help support our mission by just doing the same thing that they would do with us anywhere else.
Okay, well, any final thoughts? Yeah, I definitely love, the work that, like you said, going places where nobody else really wants to go. Wouldn't say want to go, but I would say underserved. Just any more information they want to find out about you all's program?
I think with our residency, sorry, Campbell. I think with our residency program, it's a 15-month program. It's only for people that are just graduated. They had to have graduated from nurse practitioner school in the past 18 months. We really do care about kind of the calling to help these residents become confident, competent, and successful. This first year as a healthcare provider in general, not just as a nurse practitioner, but for medical doctors as well, this first few years are extremely difficult because there's no way that schooling can prepare you for everything that you're going to encounter when you get into that patient room. There's just no way. So we believe in this program because of the massive learning curve. They need assistance. They need support. They need to be inspired. They need to be, to cultivate some of their leadership skills that they have. So we're really proud of our program and the accreditation, kind of seal from them as they accredit kind of our rigor and our excellence in this program. We're really proud of it. If anybody has any information or, desire for more information, we have a website. They can easily go visit and check us out.
Okay.
And CahabaNPResidency.com, but you can get to both from each site. So.
Okay. And I'm gonna put it on the screen as they see it. But thank you all for coming on today. Definitely thank you because I've always wondered what was the difference between that. But you all do a very I wasn't gonna say thankless job, but a lot of times people don't appreciate a lot what you all do, but I bet the doctors appreciate because a lot of times they can't even see the patients and everything. But special thanks for all the nurse practitioners everywhere. So thank you all for coming on today. Please check out what'shappenedbirmingham.com for more interviews. Don't forget to subscribe to the YouTube channel and check out the audio version of this on Apple Podcasts. Thank you all again and have a great day and have a great weekend, Birmingham. And thank you, your next local nurse practitioner when you see it. See you all later. Bye-bye.
Thanks, Jarvis.
Thank you for watching the What's Happening Birmingham video podcast. Please check out our website, app, or subscribe to our YouTube channel for the latest videos today.